we had the extraordinary opportunity to work with Zoom, which we really believe is sort of at the forefront of this. And so, Jason, please.
Thanks. Essentially, I wanted to start with really anchoring us in our healthcare vision. Providing that secure, scalable platform is critical for us. As you can imagine, we went through an incredible, Zoom boom where we had from 10 million users a day to 300 million users a day. So we have incredible reach across the world. It's I hear Zoom is a verb now for video meetings, and I really wanted to talk a little bit about some of the features and some of the things that we've been doing and the incredible partnerships like we have with Ash and Helium. There's just so many great opportunities. Next slide, please. It's been super incredible to see all the incredible uses of Zoom, from administration, education, and then the applications, talking about different ways that we're integrating with other companies and creating this holistic experience, and especially with the patient-centered care. I mean, one thing that when I was talking to Ash on the side before we were talking about the scenario of so let's say you're in let's say you're in Nigeria and you need access to doctors. Wouldn't it be incredible if, with the power of Helium and Zoom, to be able to, instead of just looking local, you could get global perspective, get global help from thousands and thousands of providers around the world. And I just see that as we're just kind of touching the surface of the opportunities that we can provide here. Next slide, please. Some of the things that I want to talk about, I've really talked about the end-to-end workflows. When we talk about Helium, is a great example of how we integrate. Zoom integrates in with all kinds of products and partners with so many great companies. We also have things like medical device integrations to build in the video or audio. One of my favorites is the dual camera, to be able to see, instead of just the face, you get another camera. So it's if it comes down to looking at surgeries or looking at all different sort of aspects, these are the things that we're really looking to drive in on at Zoom. And then the other side is we do have SDK integrations. And so, we're very flexible on how we integrate in, try to make it as easy as possible. Just leveraging Amazon or others, you can just plug in to leverage our video solutions. So very excited about that. Next slide, please. A couple things that I wanted to talk about in terms of kind of some security features that are near and dear to my heart is requiring meeting passcodes. So believe it or not, when people started using Zoom initially, a lot of people didn't. The default wasn't to actually have passcodes, and so there was if those links had gone out to multiple people can access in. We've made this by default now, and one of the standard security terms is secure by default. We've done a ton of work on that. And then as well as adding encryption for our video, for our chat, using AES 256-bit and GCM encryption there. So done a lot of work on that. So next slide, please. A couple other things that are really interesting that I like to talk about is data routing by geography. We basically have a configuration to where you can show by geography where you want the data to go in transit. I've heard so many stories about so many people use Zoom because it's just so easy. I hear stories about grandparents, you hear weddings, so many people. It's just very intuitive. And so we really try to, when we think about building security in, is we make it super simple. One of the things is we have this feature called end-to-end encryption. And there's a lot going on behind the scenes when we turn this on, but it's literally a switch. We make it just a switch to be able to enable that. And so we really focus in on making it just as simple as possible. Another interesting part that a lot of people don't know about is we actually can do watermarking on audio. We have audio signatures, and we can do watermarking on screenshots to see if you're worried about that information leaking and you want to know where it came from. There's a number of people that are using that, and that's kind of a less known feature that we have that we provide. Just a little bit about the kind of on the routing side, you can see there's the check boxes for the region. So you can choose which area you want to be able to route your data through. If you want it to be, I just want it to be in Australia or just in Ireland, we have this opportunity, and we showcase this a lot. And then because so many healthcare, financial services, and everybody's used these products, we've had a number of like pen tests, like Christian was talking about. A lot of people have tested these controls to make sure they're actually functioning properly. And so I feel like in the last year, we've had a lot of due diligence done, and I feel very strongly about these controls. Next slide, please. Another part of it is there's certification requirements for handling personal health information. We are HIPAA compliant, and we enable that out of the box. If you integrate with us, these are the sort of certifications that come with it. We are FedRAMP approved. We are FedRAMP medium right now, and we're working on going up to FedRAMP high. So very excited about that. So you can actually work with government officials or and be able to have those conversations on Zoom as well. So just wanted to put a little bit of insight there on that.
Thank you, Jason. And for obvious reasons, almost per that, why we at Helium are super excited to work with Zoom to deliver access to care that we think is critical and deeply meaningful. So it's an opportunity where really 1+1 can sort of deliver 10. And just to reiterate, like, this collectively allows us to deliver that faster, lighter, and safer care than we've ever imagined before, really across both data, people, and communications. And for those, because architecture, the goal here is to really deep down, but really one of the things that we're very clear on is we're not going to build everything. It's really, there's an extraordinary ecosystem of people, Zoom, Square, other people that are around the world that have built extraordinarily powerful, meaningful solutions, that the smartest thing is to leverage them. And that allows us to deliver an extraordinary experience and value to people around the world. And really, so what we're trying to do at Helium, just to reiterate, is, how do we get people to get that instant access to care, both, globally, powered by AI, with sort of that Uberized provider operations, and really sort of help activate the entire ecosystem, right? We talk about how there are drones now delivering medicines over in Africa and amazing things. How do we make that happen so someone can go, click, talk to a physician wherever in the world, make sure it's the right thing, have that medicine delivered to them wherever they are, and in ways that hopefully support them to live happy and healthy lives, right? And so, when we think about it, like, maybe I'm entirely biased, but I don't remember the days before Google or Amazon or Zoom. I don't, right? And so our hope is, if we can make health access really equitable, amazing, super fast, you won't remember the time before Helium either. So hello in Helium. Part of the thing with talking with Yadin and Tom and Yuntup and everybody and Elliot over at the team, we want to be also good members and partners with the entire community, right? So one, for many people that are out there, we realize that we don't always have all the insights as to what's going on every day. And so we would love, if for those who are interested, to be sort of part of our sort of global advisor group that we're looking to put together so that we can understand and make sure that we are addressing the needs of people in meaningful ways. Later on, we will hopefully host events with CED and otherwise about what other cool startups are out there. And then how is it you move from, CISOs and this clinical engineers the rest to how to be that main digital health officer, which I think is sort of going to become critically important as part of the infrastructure for nations, especially, people talk about LMIC, countries and the rest. There's an opportunity to leapfrog, right? You don't need telephone poles. It's not mobile, right? There's an ability to leverage now what's available in the cloud to create a new infrastructure, right? And sort of being at the forefront of that and how that's going to change the way care can be delivered much more cost effectively, much more equitably to people around the world and being able to run that. So we're truly looking forward to being part of the community and excited. And thank you so much for the time and obviously excited by the conversation.
Thank you very much, guys. Very, very stimulating presentations and very exciting things happening. And I particularly like the fact that we wish to work with the entire digital health family.